Okay. Hello, so welcome to this Facebook Live session here at Swansea University. Thank you very much for spending the time to be with us today. My name is Alex Perkins. I'm a senior lecturer on the Respiratory and Sleep Physiology program here at Swansea University. And I'm here to talk to you guys about careers in respiratory and sleep physiology and also about the program that we run here at Swansea. So my background personally is as a clinician working in the NHS, and I've worked in the NHS for about 20 years or so before joining the university here and teaching guys like yourselves maybe who are interested in studying on this program. The job of a respiratory and sleep physiologist is quite a broad one. We've got a really interesting role working in healthcare. Primarily, we're involved in helping to diagnose and manage and make decisions, treatment decisions about patients who've got various different types of respiratory disease. So this can be things like asthma or diseases like COPD, but it can also include lots of other conditions which are rarer and maybe less obvious, as well as lots of people with sleep disorders. And there's an interesting connection between breathing problems and sleep disorders in that a lot of the time people have no problem breathing perfectly well during the day, but when they go to sleep, there can be lots of issues with their breathing during sleep. So for me, one thing I find really interesting about the role is that we're working with a whole range of people in lots of different scenarios, and the kind of work that we do involves basically doing lots of different tests on people. So this can include things like pulmonary function tests, which is a type of test where we get people to breathe into machines, and we can look at gas exchange and lung volumes and some of the mechanical properties of the chest, and that can help us understand respiratory diseases. We also get involved with doing lots of different types of exercise tests. So you guys might have seen people on TV doing what we call a cardiopulmonary exercise test, and often you see elite athletes doing these kind of tests, and they're running on treadmills or on exercise bikes with like an oxygen mask on. Now we do the same sort of tests, but rather than testing elite athletes, we're testing people who may have some sort of heart or lung problem, and we're using that same test to try and push people to their limit so that we can understand how their body is going to respond when they're being stressed. We also do lots of different investigations that look at people's oxygen levels, breathing rates, pH and acidity levels in the blood, and this is really useful to understand people who are in what we call respiratory failure, which is when they're struggling to ventilate properly. We might be involved in making decisions about prescribing oxygen or different types of ventilator that can be used at home to help people breathe when they're struggling. And then the other kind of group of tests that we do is various different types of sleep study. So we do lots of different types of sleep study which are looking at what's happening to people's breathing during sleep. We might be looking at changes in their heart rate or blood pressure. We might be looking at changes in some brain activity and muscle tone or stiffness. And all this information is useful to help diagnose people who've got different types of sleep disorder, and again we can help make decisions then about what we can do to treat them and help them feel better. So it's a really broad range of investigations and procedures that we get involved in. And like I said, I've been doing this job for about 20 years now in the NHS. I've found it really enjoyable. But people who've studied respiratory and sleep physiology don't necessarily work in the NHS only. So some people end up going into education, such as myself. Some people end up going on to do PhDs, and they have research careers. But even people that do work within the NHS, again, there's lots of different types of roles there. So some people work as clinical specialists, and they become really real experts in particular types of procedure. Or they might be team leaders and managers involved in looking after groups of people and managing how services are being run. So there's lots of things this program of study can lead to. Here at Swansea University, it's a 3-year program in respiratory and sleep physiology. The program is run in conjunction as part of a suite of healthcare science programs, and there's lots of other programs here, and there's lots of other information on the website you can find out about those programs. So our students study with some of the other healthcare science students, and they study a range of subjects looking at human physiology and anatomy. There's some physics and maths in there, and some information about how some of the equipment works that we use. But a really big component of the program is actually work-based study. So our students spend about half their time actually on clinical placement in a hospital. And that's from pretty early on, right from the first couple of months of being in university. Our students go out on placement and they visit hospitals potentially all over Wales. And this is where they learn all these different techniques and procedures and investigations. So one thing about the program you need to be aware of is that you've got to be prepared to travel, because you will be sent all over Wales in lots of different departments. You'll get really, really good exposure to all these different procedures that we do. Certainly on our respiratory and sleep program, we're really, really keen on teaching our students more than just the basics about how to do the job, and we really try and give our students the opportunity to learn all sorts of other additional skills which are going to help them in the workplace. So for example, every year we run a conference which is aimed at all the respiratory and sleep physiologists working in Wales, and we all get together and we discuss, we have different speakers and discussing lots of different new aspects to the science. But as part of that, we get our final year students to come and present their final year dissertation project in the form of a scientific poster. So we feel this gives our guys really, really good exposure at what it's like to present work at a real conference. We have our students involved in charity work, so we do lots of work in conjunction with the British Lung Foundation, either in terms of raising money for them or in terms of public health screening, whereby we offer free testing for members of the public and staff at the university. We also get our students to try and engage with schools as well. So we have student ambassadors who may be involved in working on student projects with pupils from GCSE and A-level schools and colleges. So at the moment we're working on a project to design an infographic looking at sleep and academic performance. So again, this gives our students the opportunity to get out in the real world and give them the opportunity to share some of the information that they're already learning. Hopefully some of this is sounding interesting to you guys. So if you are interested in applying to our program, you might want to know what the entry requirements are. So typically we're looking for GCSE in English or Welsh, plus maths, plus science at C and above, or equivalent. And in terms of A-levels, we're looking for 120 UCAS points. At least one of those, or some of that at least, has to be a science subject. So if you're doing A-levels, then we need either biology, chemistry, physics, or maths, we would consider to be a science. So that roughly equates to 3 Bs. Although, to be honest, we often give a little bit of leeway in terms of the pure academic qualifications that we require, because the job itself is a communication role. You've got to be able to talk with members of the public and communicate effectively with members of the public. So it's really, really important that you have some of those sort of interpersonal skills that allow you to communicate clearly and effectively. I guess what's more important to us is that you've got a passion for actually doing the job. And so in that respect, one thing we would strongly encourage all our applicants to do if they want to apply to this program is to try and get some work experience in a real hospital, in a respiratory and sleep physiology department. Now, depending on whereabouts you are geographically, we can help you do that. We've certainly in Wales, we've got really good contacts with some of our heads of department in hospitals around Wales. So if you were struggling to get in touch with a local hospital to know who to contact, we can help you with that. If you're in England, again, we will do our best to help you make contact with whoever your local department is. And the reason this is so important is, you're making a decision now about the rest of your life and the rest of your career, and you've got to make the right decision for yourself. And because we're such a small profession, not a lot of people really know what we do. So it's really important you get out there and you get a feel for what the job looks like on a day-to-day basis. And we also think that's really going to help you prepare for the interview itself as well. Now, the way our interviews run is that we have a series of mini interviews, little activities, group activities and tasks and role plays and things. It's all very friendly, and we think we're nice, approachable people, and we're not trying to terrify anyone. We're trying to get the best out of you. So I'm here now to ask some questions from you guys if you've got any questions, but I will just say now before we do that, if for some reason you think of something after this session and you want to get in touch with us, the email address is study@swansea.ac.uk, and similarly you can post up on this Facebook forum as well too. So that's probably all I've got to say at this point, but I'd be really happy to take any questions from you guys, if there's anything you've got to say or any questions you've got to ask, and if not, I will keep telling you about all sorts of stuff anyway. So I thought it might be helpful to tell you about how I got into this role. So like I said, I've been working in the NHS for about 20 years. The way that the study program worked when I joined was pretty different to how it was now, but you can possibly tell from my accent, I'm from England, so I was living in Kent, and at the time the study was a sort of an apprenticeship route essentially. So what I did most of my studying in a hospital in Kent, and I would go away to university. And it's a similar model to that now. The difference, I guess, is that here at Swansea, you're based in Swansea, but you go away to different departments throughout Wales. So I worked in Kent for a few years, and I learned some of the basic skills and techniques about how to carry out some of these pulmonary function tests and sleep studies and things. I did most of my training in London. I then worked in a hospital in Bath, where again I developed a little bit more expertise in some of the sleep physiology side of things. And then I moved to Swansea in about 12 years ago, and when I was working at the local hospital here at Singleton, I was responsible for running the sleep physiology lab. So we would do tons of sleep studies on different people, and one of the things I really enjoyed doing was running what we call a CPAP clinic. CPAP is a type of device that some people use if they're struggling to breathe at night, and it's a kind of mask that people wear which helps keep the airway open and helps them breathe normally. And I found this really satisfying, because when people start to use these devices to treat their sleep problems, they tend to feel so much better. And so the improvement that you get when you start treating people is really satisfying. And personally, I found that really rewarding. People were genuinely really grateful that you've helped them out, and you could see the improvement on people's faces. They just look better, so much more alert and so on. And then while I was there at Singleton, sort of increasingly, I got involved in teaching here at the university. I helped out on practical exams and things, and that was about 9 or 10 years ago. And then since then, I've done more and more teaching, and now I find it really rewarding to meet guys like yourselves who are kind of keen on this topic, and I personally find it really satisfying to help our students really develop, and it's amazing to see them develop their skills and get more confident as they progress throughout their studies, really. So that's what I'm about anyway. I'm being hovered over just here. So we good? Yeah, okay, all right. So we need to sort of wrap it up a little bit now, I think, at this point. So, but thank you for spending your time. Please post up any questions that you've got. Contact us on the email address again, study@swansea.ac.uk. Okay, thank you very much.